Welcome. My name is Sarah Stallman, and I'm the Health Communication Manager for Student Affairs here at UNC-Chapel Hill. And today I'm going to talk to you about the community of care we have here at Carolina, which means the services and programs that help keep students healthy and well. In the live presentation, we would then take this slide to learn a little bit about our audience. We'd ask how folks are feeling about the coming year ahead, and also ask people to reflect on recent times that they may have visited a medical or mental health provider. And we would do that to set the stage for our upcoming conversation. We would bring all of that to the top of our minds because health touches everyone at some point or another. Student health and well-being are top priorities here at UNC-Chapel Hill because they impact a student's ability to succeed here at Carolina. And there are so many resources here to support students in reaching their goals. We'll start with student wellness. It's the Health Education and Promotion Office on campus. They educate, advocate, support, and promote wellness across campus. And what does student wellness do? They're working to shift the environment of campus to be more supportive of health and well-being across all dimensions of wellness. So staff at Student Wellness serve as mentors, advocates, and support systems to help students explore diverse experiences, stimulate strong identity, nurture a sense of belonging, promote health-supportive behaviors, and connect students to well-being services. They're offering digital and in-person health and wellness education, peer support and advocacy groups, sexual health and relationship education, as well as free safer sex resources. They offer stress management and self-care, skill building, sleep hygiene and nutrition education, individual wellness coaching to support students' desired behavior changes, and they coordinate and collaborate to create large-scale wellness events. Student Wellness also offers free and confidential substance use support resources for campus across the continuum of health promotion strategies. Students can learn more, assess where they are, join a group, meet with someone one-on-one, or support their peers. And all resources at Student Wellness are paid for through the student health fee that is paid in tuition and fees. So students can use these services at no additional charge. The mental health provider for students and postdoctoral fellows at Carolina is Counseling and Psychological Services, which is fondly known as CAPS. They work hard to meet the immediate mental health needs of postdocs and students here. Those with urgent mental health needs can access CAPS 24/7 by phone and in person without an appointment during business hours. Initial non-urgent assessments are also offered on the same day. No appointment needed. Students can come in during the initial consultation hours listed on the slide when it's convenient for them. At one of those initial consultations, the student will speak with a provider and determine next steps for their mental health care. Those next steps could include any of the following services. Brief therapy visits are appropriate for concerns that are emergent and have not had treatment in the past. That kind of therapy can be in person or online. Group therapy is also an option, which allows attendees to gain insight from others working on similar issues. Additionally, CAPS offers the Multicultural Health Program, which centers the needs of underrepresented students and postdocs at Carolina. They offer academic interventions and an ADHD clinic. CAPS also supports embedded counselors in various academic departments around campus who offer more tailored outreach and therapy specific to the needs of students and postdocs in that program who can access those supports without ever leaving the academic building. Embedded counselors are in the School of Pharmacy, School of Journalism and Media, Gilling School of Global Public Health, the School of Law, the School of Medicine, in the Biological and Biomedical Sciences program, the School of Dentistry, and Nursing. You should know that 70% of the people who want mental health support after an initial visit at CAPS are served right here on campus through the services we just discussed. Some students need ongoing therapy. That could be for issues that have had treatment in the past or students who want continued contact with a therapist throughout their time at Carolina. For these types of needs, referrals are made into the community. And referral coordination, which is offered by CAPS, can help students connect with a community provider, and it takes into account preferences and needs such as insurance, location, the identity of the provider, any specialty area, or other issues like that. CAPS wants students to have access to the mental health supports that help them thrive. CAPS listens to and understands what a person needs and adjusts services to best meet those needs and the needs of students and postdocs across campus. CAPS is primarily funded through the campus health fee, so most services at CAPS are already paid for with the health fee and offered at no further cost, with the exceptions of medication management and ADHD visits. These are psychiatry visits that are billed to insurance, so students are responsible for any copays, deductibles, or coinsurance associated with their insurance plan. Carolina offers additional mental health supports. The HEALS Care Network is shown on this slide and available at care.unc.edu. It's the online home of mental health at Carolina. Website users can filter the nearly 150 mental health resources that are available to find the ones that might best meet their needs or the needs of the person they're trying to support. The site also includes strategies for helping someone in distress, a mechanism for family or friends to notify Carolina about when a student is struggling and could benefit from additional outreach. The site offers ways to get involved in mental health promotion efforts on campus, and so we encourage you all to explore this site both today and as things get underway in the fall. Carolina also offers convenient access to healthcare services. UNC Health Campus Community is a comprehensive medical facility run by UNC Health that offers an array of services to support student health needs, including primary care, same-day care, and a mini clinic, which are like urgent care facilities located on campus, gynecology services, an on-site lab and radiology unit, nutrition, immunizations, allergy, an international travel clinic, sports medicine, orthopedics, and physical therapy, as well as a student-run campus EMS, first responder service, and contracted dental services. Campus Health offers pharmacy services in 2 on-campus pharmacies: Student Stores Pharmacy, located on the top floor of Student Stores on main campus, and the Campus Health Pharmacy in the basement of UNC Health Campus Community. I have to switch that name over in my brain. Both are full-service pharmacies and provide both over-the-counter and prescription medications, including controlled substances like ADHD medications. It's easy to transfer prescriptions. Just call or stop by the pharmacy of your choice. There are also 3 vending machines stocked on campus by the pharmacies that offer after-hours access to health supportive items. And again, next door to Student Stores Pharmacy, you can find the mini clinic, which is like an urgent care facility right in the center of campus and available only to students. There are a few items that incoming students have to complete before classes begin. These requirements can be found on the Students Connect Carolina Student Services page under To-Do List items. As you are likely aware, immunizations are required for students joining the Carolina community. A list of the required vaccines that each student needs to submit is located on the immunization form, where they can also be found at campushealth.unc.edu. The general deadline to submit documentation of immunizations is June 15th. If students are unable to complete the immunization requirements during the summer, they can receive all required immunizations on campus when they arrive in the fall. But by North Carolina state law, if those immunization records aren't received within 30 days after classes begin, the student is withdrawn from the university. Nobody wants that to happen. So the link to the immunization form is on the Students Connect Carolina Student Services page under the General Items To-Do list. After the form is printed and completed, a medical provider can either sign the immunizations page to verify the dates, or the student can attach a copy of verified immunizations, meaning they've been signed, stamped, or otherwise made official. All documents will need to be uploaded to the Connect Carolina To-Do list item. Campus Health cannot accept mailed or faxed records. Student health insurance is required for all college students going to state schools in North Carolina. If you and your student do not want student health insurance, the student must provide proof of creditable coverage. That means another acceptable health insurance policy, and they have to do so each semester. There is, however, a checkbox option for insurance information that's provided to be used to meet the waiver requirement for the entire year, and students will get an email confirmation each semester that the waiver was approved. The deadline to waive out of student health insurance for the fall is September 10th, and for spring semesters is January 31st. If students don't waive out by that date, they will be enrolled and billed for the student insurance plan. What we went over today may still leave you with questions, and with lots of changing information around healthcare on campus, it'll help you to stay connected with health and well-being moving forward. You can use the websites on the slide to learn more about specific services. We have a collaborative social media channel at UNC Healthy Hills, and we're most active on Instagram. Please take a moment and follow us there. And for families, we use the new Student and Family Program Campus ESP Family Newsletter Portal to share articles for how to support your students' health and well-being all year long right here at Carolina. Student health and well-being really are top priorities here at UNC-Chapel Hill. Students, remember that you're not alone. There are dedicated staff and loads of resources that are here to support you on your UNC-Chapel Hill journey. Welcome to Carolina. We're so happy to have you as a part of our family.